If you are going to Medicare soon, maybe you're turning 65 or leaving employer coverage, whatever, you are making a decision for your health insurance after retirement, and that's a big deal. You got to make sure you're on a plan that's going to work not just best for you, but for your budget, for your family, so that everybody's on the same page and you're getting the care and you're getting the coverage that you need. That's what your goal is here. And when you're going to Medicare, you're going to brand new health insurance. You're not going to stay on the same health insurance you've had forever. It's going to be different, and you need to make sure that you're getting on a plan that you understand and is going to really be easy for you to use. Now, one thing when you're shopping Medicare Advantage plans, most people they're shopping Medicare Advantage plans is they are getting online or they're getting mail and they're getting phone calls about something called Medicare Advantage. Getting a lot of information about Medicare Advantage. Matter of fact, Medicare Advantage is the most well-marketed product in the world. I mean, Medicare Advantage is everywhere. You get mail, you get phone calls, you see it on Facebook, everywhere. Medicare Advantage is huge, and everybody's telling you that it's free, that it costs $0, that it does this, that it does that, it has extra benefits. And those are all things that are technically true. But I want to talk about today the disadvantages of Advantage plans. We're going to talk about the disadvantages of Advantage plans because you got to find the plan that's right for you. And you need to know both sides of the coin. Now, before I really get into talking about this information, I do want to say that we would love to talk to you here. We have agents ready to talk about Medicare Advantage, Medicare supplement plans, Medicare in general. You can follow the information in the description of the video below to get in contact with one of our agents today who would love to talk about the disadvantages of Medicare Advantage plans. Now, to understand the disadvantages of Medicare Advantage plans, I want to talk about Medicare Advantage from a high level, what it is, and then I want to talk about the pros. That way you can understand what people are going to sell you on and what they're going to try to get you to see as a positive and what is actually a positive. First things first, Medicare Advantage is Part C of Medicare. So we have Part A and Part B. These make up original Medicare. Part A and Part B. This makes up original Medicare. Now, original Medicare is your primary health insurance. Part A is going to be hospital, and Part B is going to be medical. In other words, Part A is going to cover your hospital stays. It's going to cover when you're staying in a rehab facility for some time. And Part B is going to cover anything medical, like going to a doctor, going to a physical therapist, something of that nature. It's going to cover those services. And these two things make up original Medicare. Matter of fact, when you get your red, white, and blue Medicare card, it will literally say Part A hospital, Part B medical on the card. And there are some gaps associated with Part A and Part B. That's why a lot of beneficiaries consider a Medicare supplement or maybe even a Medicare Advantage plan. And what you need to understand is that as long as you've worked 40 or more quarters, which would be 10 years or your spouse has, Part A is typically going to cost you $0 a month in premium. Part B is typically going to cost people, most beneficiaries, around $202.90. That can fluctuate depending on income. It would not go down, but it could go up. This is your stock and your lowest premium that you would have on Part B. So you're going to at least pay $202.90 for Medicare in general before you get anything else. Now let's talk about Medicare Advantage. There's another part here, a third part, called Part C. And this is your Medicare Advantage that you hear about, Medicare Advantage. Now, where a lot of marketing and agents are going to sell you on Medicare Advantage is that it has a $0 premium. Medicare Advantage has a $0 premium. I want to start out by clearly saying this. That $0 premium is a $0 additional premium. $0 additional premium. You see here that $202.90 for Part B? That is still something as a beneficiary you would have to pay out of your pocket even if you were to enroll into a Part C plan. Now, what are the pros to Medicare Advantage? Let's talk about the pros real quick. The pros to Medicare Advantage, you do get additional coverage at no premium, for no cost. What I mean by that is you're going to get things like dental, vision, hearing. You'll get things like drug coverage, over-the-counter coverage, some other things that are really nice to get, and you won't have to pay anything extra for it, which is very convenient and very nice. A lot of people love that. That's actually the most popular thing about Medicare Advantage plans, why people go this direction. That's a great benefit. Number 2 is a max out of pocket. You do get a max out of pocket when you go this direction, meaning that there is some kind of ceiling that would, say this is worst case scenario, what you would spend on medical and hospital expenses in a year. And then number 3 here for a Medicare Advantage plan, as far as a pro goes, would be that you actually get to change, you can change this plan every year. You can change this plan every year if need be. You have the ability to change it every year if you need to. So it's not something that you get stuck in and have to go through underwriting. That's what I really mean. You can change this without having to go through underwriting, and there's no underwriting involved, which is a benefit. Whereas with Medicare supplements, you may have to qualify through underwriting to get a new plan. So these are great things. You can get additional coverage for no cost. You can get a max out of pocket for no cost. And I don't have to go through underwriting to change my plan. And these are the things that agents will talk about to sell beneficiaries on Medicare Advantage plans. Now, I want to talk about the disadvantages to Medicare Advantage. I want to talk about why you would not want to enroll into a Medicare Advantage plan for some reason. Number 1 is this, and this is number 1 for 99% of the customers I talk to. Doctor networks. We have doctor networks, okay? Meaning that your doctor has to be a network with the plan in order for your plan to work there. Of course, we have HMO and PPO, so I can put that there, HMO versus PPO. On an HMO plan, if my doctor's not network, I can't go there. It's not going to pay. If I go to that doctor, my plan will pay nothing. A PPO, I technically can go to a doctor that's out of network, and it would pay. I would just have to pay a larger, I'd have to pay a larger amount or a larger cost, copay, whatever that would be. I would have to pay more out of my pocket if I went to a doctor out of network on a PPO, but I could still go. Now, what you need to understand is that this is entirely still dependent on if the doctor will let you use that coverage there or not. You may have to go through and get some reimbursements. Even if you do have a PPO plan, it can still be a headache. This is number 1 for everyone as far as a disadvantage goes. Not being able to just use your doctor when you want to use your doctor can be a headache, especially if you've had the same doctor for, let's say, 5+ years. If you've had the same doctor 10, 20 years, why would you want to change? That doctor knows everything about you. You've trusted that doctor, and now you're having to change in order to get a few extra benefits. So doctor networks is definitely number 1. Now, I want to go a little deeper than just the immediate right now response. Doctor networks are a big deal, and they are a disadvantage to Medicare Advantage. However, these doctor networks can change every year, meaning that your doctor may be in network now, or your doctor may bill the PPO right now, but next year, when the new Medicare plans come out, your doctor may be completely not on the plan anymore, And your doctor can actually decide in the middle of the year that they don't want to bill this plan anymore because it's difficult. And that's actually the biggest thing, is billing is difficult for doctors' offices. Original Medicare is super easy to bill, and so your doctor's offices are actually going to be more inclined to take Medicare, and they actually have a lot more ease with it, and the billing process is very fast. With the doctor networks and how they are, billing can be very difficult, and it takes more time to get things billed and taken care of, and you can even get bills that you're not responsible for in the mail because the process is a little more difficult. So doctor networks is certainly number 1. Number 2, prior authorizations. This is a process that anyone on a Medicare Advantage plan has to go through to get a service or claim approved or denied. When you go through a prior authorization, really what this is that the carrier is going to make sure that you've not tried everything else before getting this specific service done. Maybe you want to get a surgery, they want to make sure you took this medicine or this rehab, this physical therapy, before they decide they're going to approve that. And that can be a big deal because this can take up sometimes to 90 days when you look at a full process. And if I want a surgery right now that I feel is necessary and I have to wait 90 days, that seems like an eternity. And I've had customer after customer so frustrated with Medicare Advantage because they've had to wait 3 months to get something approved that they want to get approved. Or it can be declined altogether. It can be declined altogether. Something that I feel is necessary, my doctor feels like it's necessary, and it gets declined altogether. That is something that is very alarming and can really give you a lot of scare if you're really wanting or needing something right now. Another big deal that kind of puts these into the same category, or like maybe something that I would fall into both these categories, is if you need to go to a skilled nursing facility, both of these come into play. Skilled nursing facilities, a lot of doctors are in network Medicare Advantage plans, not skilled nursing facilities. You actually see a lot of skilled nursing facilities will not take these plans at all because of the prior authorizations. So they choose not to be in the network because they have had such a bad experience with prior authorizations and getting people approved. And if you need a swing bed, or if you whatever, if you're in swing bed, it can really be a hard process. And if you need durable medical equipment, this right here is extremely frustrating. Prior authorizations, having to get it approved and getting denied, and that long process that it can sometimes be, very difficult. Number 3 is large copays. Now, I do want to be very clear. When I compare the copays to just original Medicare, it can sometimes be in favor of the copays, just to be honest with you. However, that's not the other option out there. It's not just original Medicare versus Medicare Advantage. It's original Medicare plus a Medicare supplement versus Medicare Advantage that we're looking at here. And when you have a Medicare supplement, especially a Plan G, you're not worried about paying co-pays or co-insurance at all. You have your deductible on your medical side, and then Plan G is going to take care of everything else. On a Medicare Advantage plan, you can have large co-pays for things like hospital. Those can be $450 a day for a hospital stay. Meaning that if you stay in the hospital for 10 days, you're paying over $4,000 out of your own pocket. That's a lot of money. Now, you do have your max out of pocket, but those max out of pockets can be up to $14,000 for out of network. So it can still be a lot of money. You still have a 20% co-insurance on things like chemotherapy and infusions, and that can add up. So you're talking about a $14,000 max out of pocket for out of network services. If you're taking chemotherapy out of network, you are most certainly going to spend $14,000 of your own money on those services. And when you compare that to a Plan G that you would spend $283, that's a big difference, plus premium, but that's a premium you're willing to pay in order to avoid that. So when you get all this information, when you're getting these texts, these calls, these emails, these letters about Medicare Advantage and all the great things they can do, yeah, sure, they have great pros. Remember these disadvantages and really consider, are these things that I want to take on? And if you're undecided on that and you're trying to figure out, do I want the advantages of Medicare Advantage compared to the disadvantages? Is it worth it? Or maybe I don't want the disadvantages of Medicare Advantage. I want to talk about a Medicare supplement. We want to help you with that. So follow the information in the description of the video below, and we will get an agent that wants to talk to you today. Medicare is a journey. We're a compass. Use it.